On Monday, December 30th, the documentary How to Survive a Plague will air on Independent Lens. It profiles an unlikely group of activists who helped identify and distribute promising treatments for HIV and AIDS in order to save those suffering from the disease. Well, what's being done on a local level about it right here in Western Mass? Mark Zatyrka, an HIV/AIDS advocate and board member for the AIDS Foundation of Western Mass, is joined by Jessica Crevier, Executive Director of the AIDS Foundation, to talk about the effort to fight AIDS right here in Western Mass. Thank you both so much for joining me here today. Jessica, we're going to start with you. How does Western Mass, this local area, compare to the rest of the state when it comes to the fight for HIV and AIDS?
We're certainly still at epidemic rates, and Springfield and Holyoke have some of the fastest growing rates of infection in the state, so it's absolutely a concern still.
What are some of the steps that you guys are doing to help stem this tide, to prevent it, to talk about it, everything? What are you guys doing?
We have a strong mission towards education, prevention education. HIV/AIDS is 100% preventable, but not if you don't have the information that you need to make healthy decisions for yourself. So we have a group called the AIDS No More Project, which is students from junior high through college who educate their peers in their community about the virus, how it's transmitted, how it's not transmitted through myths and facts. And really try to make sure that people have the tools that they need to make the proper decisions to prevent the spread of the virus. We also have monthly educational programs that help people learn more about the virus and how to live healthy and productive lives with it. We do guest speaking spots, both from local professionals and people living with the virus. And we also have programs that help people who are living with HIV/AIDS, such as emergency financial assistance programs.
I think another important program that we provide is at most of our events, we also coordinate with local healthcare agencies to provide free testing. There's a huge number of people who are HIV positive that don't know they're HIV positive. And so you can imagine people making decisions not knowing that they're HIV positive, how many people that can affect. It's kind of like a chain reaction. And so at our World AIDS Day event, at our AIDS Walk, we always try to provide free testing for the people that come out to that so that people at least know their status.
Now, Mark, you're an HIV/AIDS advocate for a very personal reason. I mean, this has affected you since such an early age. Talk about how your personal experience has kind of helped you in turn reach out to others that are struggling with living with this disease as well.
Right, so I was born with a bleeding disorder called hemophilia, and I ended up contracting HIV probably around the age of 2. So I've been living with HIV pretty much my whole life. I didn't find out until I was around 11 or 12 years old. I think the greatest contribution that I give to the local community is just by sharing my story. So many people still live in secrecy that have HIV because they're so afraid of other people finding out and treating them differently and losing their jobs, losing their family. So there's a huge amount of good that can be done just by sharing your story and telling people that they're not alone and putting a face to HIV. People think, there's this nasty, ugly face for people that have HIV, but everybody is affected, and there's no demographic that isn't affected by HIV.
And we applaud those people that are strong enough or brave enough to come out and face it, but it's easy for us to do that because we don't have to be the ones to kind of put our face out there and make that very scary yet courageous step to do that. I mean, and you said you were 11, 12 years old when you found out. Yeah, that must have changed your life completely, and especially as an 11 or 12-year-old boy. I mean, you're not even a teenager yet. You're worrying about, not even liking girls. You're probably still like hanging out with your buddies and your friends and, the newest video game that came out or movie. And here you are dealing with a life-changing moment, not even decision because you had no part in it. What is the biggest advice that you give to those that are struggling with, especially the keeping it close to them because they're not ready to be as courageous as you are now?
Yeah, I mean, that's a great piece of advice right there is you have to be ready. I never tell people you have to come out and tell everybody you're HIV positive because some people aren't ready for that and some people are in situations, everybody's cultures are different and other, families are different. And so it's a very hard decision and it takes a long time to make that decision. But I guess I would tell people if they are going to, decide to share their status, you have to expect everybody to know after that. You can't expect just the person you know to keep that a secret as well. So you have to be ready to handle whatever is going to come. But I also give the advice that you'd be surprised how many great people there are in the world too. And you're always thinking the worst is going to happen. But I was so surprised. It was almost the opposite, where I had nothing but love from my friends and family after I told them.
Were you around the same age when you found out you had HIV/AIDS, or were you older when you decided to kind of tell everyone and be public about it?
Yeah, I kept it a secret until I went to college. So all through high school and junior high school, I was scared to death for people to find out. Ryan White was around that time, and there's a family down in Florida, the Ray brothers, who had their house burnt to the ground when the community found out they were HIV positive. So I was scared to death that anybody would find out. So I kept it a secret. I didn't want to get thrown out of school. I didn't want to be known as a boy with AIDS. And the saddest fact right now is that kids today are still faced with that same fear. There's not really any other illness that a child can have that they have this huge fear of other people finding out. And so it's too bad that kids still have to keep it a secret. And if anything, they need more support and they need to be, connected with more people. But instead, they're stuck in the shadows of secrecy, and they can't really be themselves and reach out for help like they need.
You had mentioned earlier that people are living longer, more productive lives with the disease than they did previously. And that's kind of a double-edged sword, because while it's a wonderful thing for people who are infected and affected, it's kind of turned the conversation away from HIV/AIDS on a global scale, where people see it as a chronic manageable disease. But what they don't understand is that that's a reason to keep educating. It's a reason to keep fighting the virus, and not a reason to stop talking. There's not enough public conversation, and for that reason, the stigma remains, even all this time later.
Why is it not a public conversation? Why aren't we talking about it publicly?
At this point, it's not seen as a death sentence. It's not seen as urgent or immediate like it was. If you think a chronic manageable disease, which is what it's classified as, you think maybe diabetes or things that are very easily treated with medications. And even though diseases like that are very hard to, can be very hard to manage, HIV is different in that there's a very, very finite amount of medications and treatments available. And if you're unable to afford those medications, which are incredibly costly, or if you are unable to physically tolerate them, there may not be another set of options out there for you.
Why is this area, you were talking earlier about this area, Springfield and Holyoke right behind it, why is this area suffering so much? Is it just the education aspect of it? It's the information? I mean, why is this area being hit so hard by this?
Well, the education is definitely not available on the level that it should. I know Mark, who's worked with the AIDS No More Project, can probably speak a little better to what is out there. But also, it hits hard the IV drug use population, which is prevalent in this area, and also people of color. That's a very fast-growing demographic, so it's population-based largely.
So more information needs to go either into the drug community, in the community of color. I mean, it's just more information needs to be out there, period, so that people are more aware of it. But for some reason, we're still kind of hiding behind this cloak of secrecy when it comes to talking about such an important issue that, yes, it may be more manageable now than it was then, but it's still taking people's lives, and it still is something that is important enough to be talked about.
Yeah, and I think the education also has to remain culturally sensitive. I know the Hispanic community, it's very taboo to talk about HIV. So if you can't talk about it, you can't educate people. And so I know people who can't tell their immediate family or even their spouse that they have HIV. And so when there's that much secrecy involved and fear of people finding out, it's hard to educate them. People don't want to go to meetings. People don't want to reach out for support. So we have to find a way to really reach everybody, even the folks that have these cultural differences that are really withdrawn from the community.
And we know the Western Mass area is the proud home of a very large Hispanic community, and so there's so many great aspects to that, but it's that fear of telling their family or what their community members would say that probably keeps them, without even realizing it's keeping them hostage within this almost death sentence almost that they can't break. So we can only hope that it breaks through. We'll get through to them, and more information, more education about this. Thank you so much for coming on board, talking to the AIDS Foundation of Western Mass, doing what you guys can to prevent AIDS. Thank you.
Thank you very much, Liz.